Hey everyone, my name is Sarah Maxwell, and I'm excited to share my final Practicum project with you. Combating Burnout and Enhancing Morale, a strategic wellness initiative. Burnout among healthcare workers has been a growing crisis, especially in high acuity settings where emotional, physical, and mental stressors are prevalent. In this presentation, I will walk you through the purpose, execution, outcome of my project. This project aimed to address staff burnout, low morale, and disengagement through an implementation of a wellness-focused initiative at a medium-sized healthcare facility. The ultimate objective was to improve employee engagement, enhance the quality of care, and raise both staff and patient satisfaction. The organization where I completed my practice was a medium-sized healthcare facility that provides both surgical and general patient care, including OBGYN, neonatal, and emergency services. Along with its sister organization in the Valley, it is one of the 5 hospitals serving the communities of Menifee, Marietta, Hemet, Wildomar, and Lake Elsinore. The environment is fast paced, with both staff and patients expecting high quality, timely care. Both facilities are recognized for their evidence based practices, interdisciplinary collaboration, and ongoing quality improvement efforts. Despite these strengths, staff retention, engagement, and job satisfaction remained areas of concern that the organization was actively working to address. The need for my project became evident through multiple sources and observations. Informal assessments revealed patterns of staff absenteeism, emotional fatigue, and general sense of disengagement. These trends were echoed in declining patient satisfaction scores, suggesting a direct correlation between staff morale and patient experience. Conversations with nurses, administrative leaders, and department heads further confirmed widespread concern regarding burnout and lack of engagement. Academic literature reinforces these findings, emphasizing that burnout is a national crisis in healthcare, intensified by increasing demands and limited support systems. COVID-19 further exposed what many in healthcare already knew, that burnout and disengagement contribute to high turnover rates and staffing shortage. What remains underexplored, however, is a deeper connection between staff well-being and patient satisfaction. Understanding how employees feel mentally, physically, and spiritually, and whether they feel valued in their workplace can provide critical insight into the quality of care they deliver. As the industry continues shifting towards patient centered care, identifying and addressing this correlation is essential. Improving staff wellness and job satisfaction must be prioritized to ensure high quality, compassionate care for all patients. The central focus of my project was to reduce staff burnout and improve employee morale by implementing target wellness initiatives and enhancing engagement strategies. Burnout in healthcare is a well documented issue characterized by emotional exhaustion, depersonalization, and reduced sense of personal accomplishments. These symptoms not only affect individual well being, but also compromise quality patient care, staff retention, and overall organization performance. Recognizing these risks, the project aimed to introduce evidence based wellness resources such as stress management tools, peer support networks, and mindfulness training while also promoting leadership driven engagement efforts like regular check ins, recognition programs, and inclusive team building activities. These goals, the goal was to foster a supportive work environment where staff felt heard, valued, and equipped to manage the demands of their roles. By prioritizing employee well-being, the project sought to create a sustainable culture of resilience that ultimately translates into better patient outcomes and a more positive workplace. The goals of my project were closely interconnected, all aimed at fostering a healthier, more sustainable work environment. Specifically, this project sought to reduce staff burnout, enhance communication and leadership visibility, establish structured peer support, and ultimately elevate job satisfaction and patient outcomes. Key objectives include reducing reported burnout rates by 25%, increasing job satisfaction survey scores by 20%, improving overall morale, and lowering absenteeism and turnovers through better workload management. Another core initiative was to develop a peer support and emotional debriefing program to provide staff with regular outlets for stress relief and shared experiences. These goals were driven by growing evidence and literature linking staff well-being to patient outcome. Clinician burnout is associated with lower patient satisfaction, increased medical error, and higher turnover rates. Moreover, leadership engagement and visible support have been shown to improve staff morale and reduce emotional exhaustion. By implementing wellness programs and structured engagement strategies, the project aimed to build emotional, mentally, and spiritually resilient teams. The underlying assumption was that as burnout decreases, morale and engagement naturally rise, leading to more compassionate, consistent, high quality patient care. Ultimately, all of these efforts contribute to the broader organization objective, cultivating a safe, effective, and supportive care environment for both staff and patients. Several barriers emerged during the planning and early implementation stages of the project, many of which are common when introducing wellness initiatives in high pressure healthcare environments. One of the primary challenges was staff skepticism. Due to the previous failed initiatives and ongoing burnout, many team members were hesitant to engage in yet another wellness program. This resistance to change was compounded by limited time and resources. With packed schedules and ongoing staffing shortages, it was difficult for employees to participate in additional activities, even when they were intended to support their well being. Communication gaps also hindered early engagement. Not all departments were fully aware of the available wellness resources or how to access them, which created inconsistency in implementation and participation. Additionally, financial and budgetary constraints posed a significant obstacle. Leadership expressed concern about long term funding of wellness programs and questioned whether these efforts would yield a measurable return on investment. Gaining leadership buy in required presenting data on long term benefits of employee wellness, such as improving staff retention, reduced absenteeism, and enhanced patient satisfaction. Despite these hurdles, the project moved forward by addressing each barrier directly, building trust with staff through open dialogue, integrating wellness efforts into existing workflows, and providing evidence based justifications for resource allocations. By approaching these challenges strategically, the foundation was laid for a sustainable wellness practice and a culture shifting towards valuing employee well being. Implementation began with staff wellness surveys aimed at identifying specific needs, concern, and preferred forms of support. Using the feedback, we introduced several targeted initiatives, including voluntary check ins, resilient training, peer debriefing sessions, and emotional support resources. Leadership rounding was also incorporated to increase visibility, foster open communication, and demonstrate organizational support. We intentionally began with small scale pilot efforts to test feasibility and the impact of these interventions. The small wins, such as positive staff feedback and increased engagement, helped to build momentum, strengthen credibility, and encourage broader participation. Collaboration with the department leaders was essential in adopting the intervention to fit existing workflows while minimizing disruption. This phased approach allowed the project to evolve responsibly, laying the groundwork for long term integration of wellness practices into the organizational culture. Early feedback from the pilot implementation was overwhelmingly positive. Staff and participating units reported feeling seen, heard, and generally supported, leading to noticeable improvements in morale and engagement. These results played a key role in leadership's decision to formally launch the C Care program, a structured wellness initiative focused on supporting emotional and mentally well being in a sustainable way. Though still in its early stages, the program is already fostering a culture shift. Staff are more openly expressing their needs, engaging in wellness check ins, and collaborating with renewed energy. Immediate outcomes include improved morale, reduced stress, and stronger peer support, which helps secure broader organizational buy in. Looking ahead and supported by national trends and research, the expected long term benefits include lower burnout related turnover, higher staff engagement, improved job satisfaction and retention, and enhanced patient care and satisfaction. These early successes have created a solid foundation for expanding and embedding wellness strategies across the organization. Stakeholders, including HR, the quality and wellness teams, clinical leaders, and staff, responded positively to the project. Initial skepticism faded as the project's alignment with organization strategic goals became clear. The use of feedback loops helped build trust and transparency. Staff, particularly in departments where leadership had previously been less engaged, expressed gratitude for being heard and actively included in the process. To support long-term sustainability, I created a detailed handoff plan and partnered with leadership to launch a wellness task force composed of department-based wellness champions. This team will oversee the initiative, monitor KPIs, and make data-driven improvements. While specific elements may evolve, the culture shift towards prioritizing employee well-being is already underway, a meaningful achievement. To embed wellness into the organization's foundation, we aligned strategies with hospital policies and strategic goals. Monthly KPI reviews and stakeholder dashboards will promote transparency, leadership engagement, and accountability. Aware of financial constraints, the task force will prioritize low cost initiatives, internal resources, and external grants. These structures will help keep wellness visible, adaptable, and integrated into the organization's culture. The CARE program offers a solid, sustainable foundation, but long term success will rely on continued staff engagement and thoughtful financial planning. Even if the program does not last indefinitely, it has created a lasting roadmap and mindset shift towards wellness. As a part of my final as a part of the final phase of the project, I officially handed off all materials and responsibilities to my preceptor and the leadership team. To support a smooth transition, I developed a comprehensive handoff plan that included a detailed proposal, a KPI tracking sheet, and clear recommendations for the next steps. Key recommendations included regular staff check-ins, quarterly committee reviews, and the potential expansion of the initiative to include peer support programs and partnership with mental health services. I also emphasized the importance of integrating staff feedback and refining implementation timelines to ensure the program remains responsive to evolving needs. Additionally, I encouraged the exploration of technology-based solutions to reduce documentation burdens and improve program accessibility. A follow-up meeting is scheduled in the coming weeks, during which I will review early results and provide any additional support needed. With the foundation elements in place, the project is well positioned to grow and adapt under the current leadership of the organization. I entered this practicum with the goal of strengthening my skills in change management, budgeting, and strategic communication. Throughout the course of the project, I was challenged in each of these areas, which helped me grow more confident and capable as a healthcare leader. This experience enhanced my abilities in change leadership, interdisciplinary collaboration, and stakeholder communication. I became more comfortable navigating complex dynamics, presenting data driven insight, and adjusting implementation strategy based on real time feedback. To continue building on this growth, I plan to pursue further opportunities such as collaborating with administrative leaders on financial planning and budgeting processes, observing conflict resolution in real time, interdisciplinary settings, and participating in ethic committees to gain practical insight into complex healthcare dilemmas. Additionally, I aim to lead further initiatives focused on communication and surgical safety to refine my advocacy and leadership skills. These ongoing efforts will support my development of a well rounded, evidence informed leadership foundation, preparing me to take on more advanced roles in healthcare administration with confidence and purpose. One of the key lessons I learned during this practicum is that burnout is a systemic issue rooted in organizational culture, not just an individual problem. Sustainable change requires leadership that listens with empathy and takes strategic, data informed action. When staff feels heard and supported, they are more willing to engage in solutions. Small, consistent efforts aligned with organizational goals can significantly improve morale and patient care. Embedding wellness into the organization culture is essential for long term system wide transformation. Reflecting on this journey, several key insights stand out. Burnout is not just a staffing problem, it's a system problem shaped by culture, leadership, and communication. Meaningful change does not have to be large, it simply needs to be authentic, empathetic, and evidence based. I've learned that effective leadership starts with truly listening to those on the front line. When the staff feel supported, their engagement grows and patient care improves. Professionally, this project has helped me grow into a more confident, compassionate leader ready for greater challenges. Thank you for taking the time to learn about my project and for supporting me throughout this practice.